Hey guys, welcome to my YouTube channel. I am Ms. and I'm back with another video. Today I will be talking about the different birth options that you have as a pregnant mom who's about to give birth. And essentially there's two options that you have. You can either have a cesarean section, which is an operation, or you can either give birth naturally, which is a natural vaginal delivery. So that's what we'll be talking about today. If you haven't subscribed to my channel, please do the right thing. Please join the family. Please help me grow my subscriber count and grow my channel. And please click on the notification bell so that you do not miss out whenever I post a video. And what else? Please comment on this video. Do engage with me in the comments, and give this video a thumbs up if you enjoyed it. So without any further ado, let's get on with the video. So I will be talking about our two birth options, as I said, our natural vaginal delivery and our cesarean sections. I'm going to talk about the indications for both of them, which basically means when would you have to do a cesarean section or when would you have to do a natural birth. And then I'm also going to talk about the process, when to go to the hospital, how everything will happen when you go and deliver, the requirements from you as the mom, and just like a bit of how to prepare yourself and what to expect. And then I am going to talk about how long it will take for you to recover, your recovery. And then the last thing that I will talk about is the complications that you can expect, that you might or might not have from each of these two birth options. So yeah, if you're pregnant, if you're on this journey of pregnancy, you're about to deliver, I think it would be a great thing to watch this video so that whether you're going to have a natural birth or you're going to have an operation, you can be well prepared, know what to expect, know why you will have to do, or you might have to do, a cesarean section, know why you'd have to do a natural vaginal birth, right? So obviously as a midwife, I advocate for natural delivery. I mean, it's the best thing, it's the best thing for both the mom and the baby. There are a lot of benefits when it comes to having a natural delivery. Yeah, but a lot of people actually just prefer to do an operation, and I don't know why that is, but like I've had a lot of women while on the delivery bed, they just feel like you know what, let's just go do a C-section, and some women would gladly choose a C-section, instead of a natural birth. So what are the benefits of having each of them? Actually, are there any benefits? Are there risks? Are there things that you need to think about that might have risk or complications? So that's what we'll be talking about in this video, and I really hope to make it very short, yeah, because I just want to cover this topic like very quickly. Okay, so what are the indications for natural vaginal birth? So it's very simple. If you are having a low risk pregnancy, you don't have any medical conditions, it's your first pregnancy, or if you've been pregnant before, you never had any complications in your previous pregnancy, and you gave birth naturally in your previous pregnancy, then you will definitely be having or indicated to have a natural delivery in your current pregnancy. And then what are the indications for a cesarean section, which is an operation? If you've had one cesarean section before, then you would be advised to either do another cesarean section, which would be like a planned operation now, or you would be advised, if you would like to try it out, to just try out having a natural birth after you've had one cesarean section. And we call that a VBAC, which stands for vaginal birth after cesarean section. So you're only eligible to try or attempt a VBAC when you've had only one cesarean section. If you've had more than one cesarean section, then you cannot do VBAC. You cannot try out for a VBAC. If you are someone that has two cesarean sections previously and you're pregnant again for the third time, then you will definitely have to go for a cesarean section. You cannot try out natural birth. And this is because of one of the things that an operation on your uterus does. So when they cut you, when they are doing their operation, when they're doing the cesarean section, that causes you to have a weakness in your uterus, right? It forms a scar over time as it heals, that part where they made the incision or where they cut you. So in your next pregnancies now, when you are in labor, and when you are pregnant, the uterus has to expand, become bigger as it accommodates the growing baby. And when you are in labor, your uterus has to like contract like that to cause the baby to go down so that the baby can be born, right? So if you have, the more scars you have on your uterus, the more weakness you will have on your uterus where the scar was. And that place where the scar was can be a place that can eventually cause the uterus to rupture if the contractions are too strong, and you can end up bleeding a lot. So that's a very, very serious complication. So that is why the more you've had an operation, it is not advised for you to go and now do a natural delivery, because that will put you in a condition now whereby you are having labor contractions and they can cause your uterine to rupture depending on how strong they are. So that's something that we want to avoid. So if you know you've had two cesarean sections, you definitely do not want to deliver naturally, and you will not even be advised to do that actually. Right, so that is one of the indications for a cesarean section if you've had one cesarean section or more than one cesarean sections. Other reasons why you would be advised to do a cesarean section is if you have a condition called Placenta Previa. So like I mentioned in my previous point, is that let's say this is your uterus and this is where they made your scar, right? Where they cut you the last time when you had your operation. So when the baby is growing now, you are in another pregnancy now, the baby is growing inside the uterus. At that point where they cut you the first time, your placenta that will be feeding your baby nutrients and oxygen, it will have to now find another place in the uterus inside to form itself. I'll see if I can't find a picture and just link it up here so that you can be able to see what I mean in terms of like how a placenta is situated inside the uterus. Okay, fine. So what happens now in placenta previa is that instead of the placenta attaching itself anywhere else in the uterus, I mean, it could attach itself maybe at the anterior, at the top of the anterior. It can attach itself on the side of the uterus. It can attach itself at the back of the uterus, or at the back of the uterus. So now what happens in placenta previa is that the placenta will attach itself very close to the cervix. So now that will cause you to have bleeding. Before you go into labor, you might find that you'll be bleeding, or when you are in labor, the bleeding will even now worsen. So that's also another emergency, because you can bleed to death, and we definitely do not want that. So that's one of the indications for a cesarean section. And then another indication of the cesarean section would be if you're having something called placental abrupture. So we are still talking about the placenta. So the placenta is attached on your uterus, right? It's feeding your baby nutrients and oxygen. And then for some reason throughout your pregnancy, that placenta detaches itself. So it separates from the wall of the uterus where it is attached. So now, if it's separated like this, there will be an outlet for blood. So all the blood that's coming from your body and that's coming into the placenta to go to the baby through the umbilical cord, that blood, instead of it going to the cord and going to the baby, it will be emptying itself inside your uterus. So now you have a condition whereby you are bleeding inside your uterus and the baby is not even getting the necessary oxygen and nutrients, or those nutrients and the oxygen is decreased because of this bleeding. So that's also something that is very, very dangerous, because it can cause you to lose your baby if your baby is not getting the blood and the nutrients and oxygen that the baby needs. And it can also be an emergency for yourself as the mom, because you can bleed a lot. So in such a case whereby a woman is found to be having that placental abrupture, perhaps because maybe she was bleeding and she's having this abdominal pains, so then she will be rushed to do emergency operation. And then another reason why they would do an operation is if you have a condition called cephalopelvic disproportion, which is called abbreviated CPD. So CPD basically is when your pelvis cannot allow your baby to pass through, to go into the birth canal and be delivered naturally out of your vagina. So you would find that in people who they get into labor, but you find that they're having this period of like a very long labor and the baby is not coming down. So when the woman is being examined through a labor, the baby is not coming down the birth canal, and on top of that, the baby's bones of the head, they like start to sort of like override each other like this. So then a woman would be sent, if that's happening and the labor is very long, the woman is not progressing well and the baby's head is not going down, then a woman would be sent to the hospital to try and find out if it's not this cephalopelvic disproportion. Another indication for cesarean section would be if you are having preeclampsia or you are having pregnancy-induced hypertension. So you're having very, very high levels of, not high levels, but you're having like a very high blood pressure. Yeah, so a very high blood pressure can also put you at risk of having placental abrupture, where your placenta detaches from the uterus. So definitely you get to the hospital, you're having this high blood pressure, the first thing would be to try and bring it down, and if it's not coming down, then you'd eventually have to have that baby delivered via an emergency cesarean section to protect you and to prevent complications in the mom and also in the baby. And then there are also conditions whereby a woman is in labor and she's having contractions, she's having pain, and perhaps she is progressing well or she is not progressing well. Then when we measure the woman's, not the woman's, but the baby's heart, when we measure the baby's heart, we find that the baby is in distress. So how we know that the baby is in distress would be if the baby's heart is going down. If the baby's heart is going down. So usually we want the baby's heart to be between 120 to 160 beats per minute, right? But if we start to notice that after contractions the baby's heart goes like down, maybe it was at 140 something, and then when a woman is having a contraction it goes down to like 100 and something, that would mean that the baby is getting tired. And then in some cases the baby's heart will just go down like constantly. It won't be a thing that is affected by the mother's contractions or the mother's pain. So you'll find that that could also be a reason that the baby is in distress, and that could be caused by a lot of things, like the baby having a cord around the neck, inside the womb. And then if it has to do with the contraction, it could also be because the cord is being like compressed. So when the mother is having a contraction, the blood flow to the baby is decreased, so the baby's heart goes down after some point, right? And at first the baby's heart will probably like go up, right? Because what happens in the body is that if you are going through a stressful situation, right, the first response of your heart will be to increase the heart rate, which means to beat faster, right? To try and get as much blood around the body as possible. But after some time, the heart will start getting tired of that emergency response, and it's slowly going to start to slow down. So the more the heart is deprived of oxygen, after it's been working so hard to try and pump blood all around the body during the stressful situation, it might now start to actually slow down. So that's what happens, and we call that fetal distress. Yeah, so if the baby's heart is going either going very high or going very low, then we are worried about the condition of the baby during labor, and then we'd have to send the woman to go and be assessed, and possibly a cesarean section would be done. Yeah, and then the last thing that I will mention when it comes to the indications or the reasons why a woman would have to do a cesarean section is some women will be in labor for very, very long hours. And in labor, we have certain stages. We have the first stage, the second stage of labor, and the third stage. The first stage of labor is that stage where the woman starts to have contractions to the time when the baby is delivered, right? So in the first stage, we also divide the first stage into latent phase and active phase. When a woman is in labor, we do a vaginal exam, which is called a PV. We call it a PV, and that exam is basically to show us how open the woman's cervix is. So before the onset of labor, a woman's cervix is supposed to be closed, but as labor progresses, it's supposed to slowly open up to allow for the passage of the fetus when the fetus or the baby is being delivered, right? So during labor, we will we will check the woman's cervix and to see how far it is opening. So in the latent phase, your cervix will be from 0 to 4 centimeters, and then 4 centimeters to 10 centimeters when you are fully dilated and the baby's head can now come out. We call that the active phase of labor. So some women, you will find that they're not progressing so well in the latent phase of labor, which means the cervix is not opening as it should, right? So usually the latent phase of labor, we give it, if it's a first time mom, we'd give it like 8 to 12 hours. And then the active phase of labor, we want to give it about 6 to 8 hours, right? So you'll find that some women are in labor, but they're not progressing so well. They literally pass 12 hours. Maybe they started on 2 centimeters when they got admitted, and they are on 2 centimeters for the whole 12 hours. So that means that they are stuck in the latent phase for a whole 12 hours and they are not progressing well. So someone like that who is progressing very poorly, we'd have to send them to the hospital as well to be able to be assessed, see if their labor needs to be induced. Is it the contractions, they are not strong enough? If that's the case, then probably they will, at the hospital, they will give her some medication that will help the contractions to be stronger. And then if that also fails, then a woman then would have to be taken for a cesarean section. And then lastly, Also, if a woman's baby is suspected to be big, perhaps her abdomen is bigger than her dates. And by dates I mean how far pregnant she is. And then also if she is post dates, meaning that she's been pregnant for more than 40 weeks, which is 10 completed months, then a cesarean section would also be indicated. And you find these big babies usually in your diabetic mothers, but other people, they also can give birth to big babies that are like more than 4 kilograms. And this is like after the woman has given birth, the baby weighs more than 4 kilograms. So yeah, if this is suspected, then a woman would be advised to have a cesarean section operation, because sometimes these babies are too big and they cause, or their weight results in difficult deliveries, especially when the woman gets to the stage where she has to push. You can find that maybe the head comes out and the shoulders are stuck, which is a condition that is called shoulder dystocia. Yeah, so that can be very, very difficult to deal with. It can be very difficult to deliver that baby if the baby is too big. So we want to really just avoid. So what I can say is that, just in summary of the indications for a cesarean section, is that some cesarean sections are planned, which means they're elective. For those people who already had cesarean sections, you might have a planned cesarean section just because you had a cesarean section before, not necessarily because there's anything wrong with the baby, or there's anything wrong with you as a mom, or there's anything wrong with your labor, but because you had a cesarean section before and you choose to have it again, then you might have an elective or a planned cesarean section. And then some other cesarean sections are not planned. They are due to a complication arising during your pregnancy, if it's a medical condition like high blood pressure, or a cesarean section is done because a complication arises before you get to labor, like bleeding before you get to labor, as a result from things like your placental abrupture, or a cesarean section will be done because a complication is arising when you are in labor. And with these reasons that I just mentioned now for a cesarean section, not looking at the planned cesarean sections, but looking at the other ones that I just mentioned right now, it's either that you can have an emergency cesarean section. For something like placental abrupture, you will definitely have an emergency cesarean section. Also, for high blood pressure that's not being getting stabilized, then you'll have an emergency cesarean section. But some of these things are not necessarily emergencies. Like, for example, if you are post dates and they try to induce you and the induction doesn't work, and then they would then have to schedule a cesarean section for you. So something like that, it's not really like an emergency that has to be done like within the next few hours, like a placental abrupture. So the emergency cesarean sections are those things that your baby's life and your life depends on it, and it has to be done within the next few hours. So those are the indications when it comes to natural delivery and cesarean section. So as I was editing my video, I realized that it's gonna be quite long, and I was actually hoping that it would be like a very, very short video. So yeah, that didn't work out because Shali's talks. So I decided that I will just make the video a part 1 and a part 2 series, and also just change the title. So in this part 1 video, as you have seen the video, if you watched it till the end, I was talking in this video about mostly the indications for cesarean section, and I also spoke a bit about the indications for a normal birth, right? So in the next part of this video, in part 2, I will continue and talk about how to prepare yourself, how long you will stay at the hospital when you have each of these two methods of childbirth, and the possible complications. So if you have any questions that you want me to address in the next video, in the part 2 of this video series, please leave them in the comment section. And anything that has to do with your cesarean section, anything that perhaps I mentioned, or anything you'd like to know about, please just leave it in the comment section, and I'll make sure that when I do the part 2 of this video, I will answer those questions before I continue with the content. So thank you so much once again for listening and watching this video. Thank you for the support. Please don't forget to give this video a thumbs up, subscribe to my channel, and click on the notification bell. I love you guys so much, and bye. See you next time.